Hey folks, how are you? My name is Dafna Lender. I am a licensed clinical social worker, and I'm going to be presenting at the Attachment and Psychotherapy Conference that's happening online March 14th and 15th. And you can look into registering by going to pessy.com/family bonds. And today, I just want to chat with you about the presentation I'm giving on March 14th as part of the Attachment Conference. My interest is on prevention. When I think of attachment issues, I immediately think of children who are suffering as a result of their relationship with their parent, and that we can, as therapists, help to improve that child's attachment model in order for him to grow up and be a parent, an adult, who doesn't pass on the insecure attachment style or the trauma, the intergenerational trauma that is typically being inherited and generated and passed down from one generation to the next. That's my idea, is prevention. What does that mean to me? It means that I would like more family therapists to be encouraging their colleagues and themselves to really put the parent and child into focus and work with the parent and child together in family therapy. So I've created a model, and it's called Integrative Attachment Family Therapy. And it is based on the 28 years that I've been doing attachment-based work. I started out working in therapeutic foster care, and my job was to take kids who had been in a residential program for maybe up to 2 years. They were 6 to 12 years old, and find them a foster home, a permanent long-term foster home, or an adoptive family. And these were the toughest kids who had had abuse and neglect, separation and loss. They were doing the kinds of behaviors like hurting the family dog or destroying property and being aggressive. And the parents very quickly had a near collapse of their own sense of purpose, their sense of selves as parents, as humans. And it shocked me so much that I had not been prepared at all for this kind of work, that I started reaching out to different therapists and different modalities, thinking, how am I going to be? I'm the one who's going into the home, working with a parent and child together, not in the office where I can see the child alone and be able to play with them and have the dollhouse and the sand tray, things like that. That wasn't my territory at all. I was in the home, and I was hearing the foster parent saying, he's hurting the family dog. He is coming at me with a knife. He took the drapes that I made, and he cut them on purpose because he knows how proud I am of them. And these families who I had seen before they had their child placed, all of a sudden, and the parents were absolutely delightful. They were normative in terms of they had all of the best self-reflection skills, self-regulation, very accomplished. Many of them had already been parents to biologic children. And I see them, and all of a sudden they're looking like people who are hopeless, helpless, resentful, depressed. I couldn't recognize them. So in looking around, I only saw therapy modalities who largely work with the kids alone. Yes, some of them had a parent observe, or some of them had some parent coaching every once in a while. I was struck that there was very few resources and modalities to learn where upfront and from the beginning, the parent is the focus in helping the child feel more regulated, more connected, more understood, to have the sense of relaxation and fun that they need from a parent, which is really what attachment theory is about, those qualities. It really became very curious to me, is why not? Why are these modalities not front and center? And I ended up interviewing hundreds of people to find out what are the barriers to working with a parent and child together. And they came up with a consistent list of many different very serious barriers. One was that, first and foremost, the parent didn't want to come. They wanted to drop the kid off and they wanted to go to Target while the therapist fixed their child. Number two, the parents were really defensive and felt that the therapist was blaming them anytime they invited them in for a conversation. Number three, the kids were incredibly messy and they're a handful and they jump around and they make you feel like a fool. So if you have somebody in there watching with you, it makes you feel even more foolish that you can't get their child to cooperate. Number four, it replicates a lot of the sense of, we have a sense of our own helplessness as children. We are identified with the children when we get angry at the parent, and we feel small vis-a-vis the parent, and we want to please them. So then we start having some mixed allegiances if we have a parent and child together. And the list goes on and on, that you can't bill if you're seeing the parent without the child, that there's obstacles for billing. Who's the client? You need to give them a diagnosis. So much of our modern culture is actually against seeing the relational aspect as the most important aspect. And I'm here to try to challenge that and essentially really give tools to make clinicians who work with families, who work with parents, who work with children, who work in maybe educational contexts, the tools to set up therapy from the beginning that's family therapy from an attachment perspective, with a structure to it that gives you tools, what to do, who to meet with, what the goals are. And so I think that's the missing ingredient to clinicians who are very interested and willing, in theory, to work in the relational way from an attachment perspective and have the parent and child together, but have come across so many frustrations and a lack of applied models. So the idea that I am proposing in the workshop is, first of all, we have to look at the parents and we have to work with the parents. One of the things that I think is imperative is to tell parents from the beginning what we expect of them in therapy. This is family therapy from an attachment perspective. Here's what this means, mom, or dad, or mom and mom. We are going to be working together also on your attachment history. That means I'm going to be asking about your attachment history, and I'm going to be asking you about your childhood as a way of understanding what you're bringing to this, because the relationship is 50-50, what you're bringing and what your child is bringing. That doesn't mean that you caused his problem or that his organic issue, what started out as an organic issue like ADHD or sensory issues or things or learning differences, that you caused those. However, the context is that a child always is placing their ideas about themselves through the lens of how their parent is looking at them and regarding them and reacting to them. So the child is asking, how do you see my dysregulation? How do you see my ADHD? What do you think of me when I push another kid in the playground, or when I push on you, or when I run around and cackle and do things that are really loud and disruptive in the grocery store? And this is why we have to work with you, because one of the number one factors in providing a secure attachment is the attachment figure, the person who's the caregiver for the child, is able to reflect on their own childhood experiences and their behavior and see how that connects with the child's experiences and behavior, and then be able to take account of my side as a parent so that I can see more clearly what's happening with my child. Okay, seems like a pretty straightforward and noble premise for therapy. It causes a huge amount of resistance and disruption from the therapist and the parent, because immediately the parent feels judged and blamed, and the therapist feels like, who am I to, usually the therapists are often younger than the parents, and they may not be parents themselves, and they have a sense that I'm doing something that the therapist, the parent didn't contract me for. So I'm I'm suggesting that people really very plainly put out, and I have my own, what I call my manifesto, something I wrote when I was very frustrated with how I was putting out my own messaging about what I do, as to what we are contracting into. And that means I'm going to be meeting with you for the first 3 to 5 sessions by yourselves as just the parents, to really spell out this framework. We're going to be talking about your attachment history, and I'm going to give you some tools and premises. What is this therapy? Because it's really a mystery. Most parents, they have no idea what is going to happen in the therapy. What do I expect when we walk into the room? What are we going to talk about? What are we going to do? How am I going to feel? And I like to tell parents what some of the tools are and some of the structure. So those are the first 3 to 5 sessions are going to be with the parents only. And then the second stage is the dyadic work, which means I want to work with one parent and the child, and I'm going to pick the parent. If there are 2 parents, I'll talk with the parents and see who would like to start. And there's a number of factors. I can't get into it right now, but my book, Integrative Attachment Family Therapy, has all the considerations. And I do like to work with both parents eventually, but I'd like to work with one parent first and the child. One of the main reasons is because a child has a distinct attachment classification with parent A and parent B. And when I have all 3 of them together, there's a lot of crosswire. And we have a lot of things that are going under the surface between the parents, and not necessarily between the parent and the child. But you're, as a sensing therapist, you're wondering who's giving nonverbal messages to whom, and what's really going on here when we have 3 people. So my idea is work with one parent first and the child, and then you can move to the second parent after a sequence of about 8 sessions. But in this second stage, which I call the dyadic stage, we still have every 4th session at least is a parent session only. And this comes both from the 2 models that have been I've been trained. Fundamental and foundational, most formative trainings are theraplay and dyadic developmental psychotherapy. These 2 therapies, and I'm a trainer in these therapies and a supervisor, put a tremendous amount of emphasis on working with the parent on their reflective capacity on a regular and frequent basis. And this is, again, this causes logistical issues. This causes issues about the parent feeling blamed or fatigued. And that's okay, because what I typically do is I try to predict that that's going to happen. But I also let them know that we can talk about it and modify it, and that I will try to be as flexible as possible, including meeting on Zoom for the parent sessions. So in working with the parents, this is one of the major reasons why this therapy works, is working with the parents. About 50% of the overall treatment is directed at the parent-only work. The dyadic sessions are going to be a combination of having fun, connecting, relaxing play activities with the parent and child, guided by the therapist, as well as a portion of the session, maybe about a third, to talk about things that happen during the week that might be things that are tough, things that are stressful, things that maybe went wrong. And this part of the session, I have a whole section of training on how to facilitate a dialogue between a parent and a child that is structured enough so that neither the parent nor the child gets overwhelmed by negative information or too many words, And one of the main features is we're not looking to problem solve. We're just looking to understand and primarily for the parent to be able to listen to their child and provide a responses of acceptance and empathy for how they're feeling underneath their behaviors. And that's a really important attachment principle. We're not looking to solve problems. We're looking to connect and make the child feel understood and that they feel safe in their feelings of the negative affect that they feel, whether they feel lonely, angry, hurt, jealous, clingy, ashamed, less than, that they don't have to carry that by themselves. And moreover, they're not judged. Their parent understands them and is on their side. So that those facets of that, those dyadic sessions, each have a lot of different techniques and tips and do's and don'ts. All of that is going to be in the in my workshop, and hopefully that will give a really strong basis for what is attachment work with children and their parents. So I really invite you to come and join us and learn with us at the Attachment and Psychotherapy Conference on March 14th and 15th. And check out pesi.com/family bonds for more details. Thank you so much.